Hi, I'm Dr. Tatis Krasian, and I want to talk to you about how neuroinflammation can completely sabotage clinical effects when a patient has underlying neuroinflammation. So, whether you're a physical therapist trying to rehabilitate the brain after a traumatic brain injury, whether you're a chiropractic neurologist, functional neurologist, or a neurooptometrist engaging in different types of brain exercises to regain brain function, one of the things that you have to understand is that when there's an underlying neuroinflammatory mechanism, it becomes virtually impossible to get clinical effects with the patient doing any type of activation. So let me explain to you what happens in neuroinflammatory states. When the brain is inflamed, the glial cells are activated. They're releasing inflammatory mediators. And one of the things that happens with these inflammatory mediators is that they uncouple neuron mitochondria. So the mitochondria in neurons are making ATP, and that leads to neuron endurance. It also helps control the sodium-potassium pump to modulate the electrical chemical gradient. When a patient is neuroinflamed, has significant amounts of inflammation in their brain, from whatever the cause may be, maybe it was the traumatic brain injury, maybe it's an underlying diabetic pattern that's causing glycolylated end products, maybe it's systemic inflammation, who knows? But for the concept of what we're trying to go through with this talk, when a patient has underlying inflammation, these inflammatory mediators uncouple the mitochondria and there's decreased ATP. So what that means to you is if you're doing neurological rehabilitation, is the patient's going to fatigue no matter what you do. So you're going to do a couple types of therapies and they get exhausted. Their endurance can change from one day to the next. So one day they can handle X amount of stimulation and the next day they can't, and then the following day they totally crash. That's a common thing to see when patients have neuroinflammation. Another thing that's really important to understand about neuroinflammation is that when patients are inflamed, it's very difficult to have neurons branch together. So this whole concept of developing plasticity or having neurons or axons branch into each other really requires the release of growth factors. So during inflammatory states, these growth factors become suppressed. So things like brain-derived neurotropic factor, glial cell line-derived neurotropic factor, IGF-1, neurotropin-3, they all become depressed. So it's very difficult to have neurons connect to each other in underlying neuroinflammatory states. The other key thing that happens when the microglial cells get activated is that the NRF2 signaling pathway gets disrupted, so it's very difficult to help with developing plasticity and connections doing any type of therapy. So if you are a person that engages in brain rehabilitation exercises, you should know that an underlying inflammatory condition could be a key mechanism why some of your patients may not respond. Another clinical pearl to know about is inflammatory rebound phenomenon. So if you ever work with a patient and you're doing any type of neurological therapy protocol, and initially they may have great benefits and all of a sudden they crash and get worse than before, this often happens when people have an underlying inflammatory issue. So it's an important concept. One of the things to also know is that when you activate the brain and neurons, that actually has an anti-inflammatory effect. So some people have brain inflammation, you start activating the brain inflammation goes down, they function, they feel better. But it typically isn't enough to dampen a ongoing inflammatory mechanism. So then once that mechanism is no longer working and the inflammatory cascade takes over again, patient loses all the clinical effects and gets much worse. And this is sometimes confusing for many practitioners, but it's very, very common. So anyways, I hope these clinical pearls help you and understand the importance of neuroinflammation. If you want to learn more about neuroinflammation, please join us at the Krasian Institute for our neuroinflammation course. Thank you.